So a body lift is a major transformative procedure. Now this surgery is mainly intended for patients who have had a massive weight loss or a major body change due to age or pregnancy related changes. The focus of the surgery is to remove all the excess skin to give a more toned up and a firmer and a much better definition. This is usually targeted at the areas of the lower abdomen, flanks, back, or the thighs and the buttocks. Now this is a major undertaking. Usually the patient has to have a pre-evaluation to prepare for the surgery. So during the surgery, the excess amount of skin is carefully and precisely removed and the remaining skin is tightened to give that fantastic look. Now since this is a major undertaking, a lot of pre-evaluation and aftercare planning is necessary. The first few weeks are having discomfort with pain, swelling, and loss of day-to-day activities. However, the patient recovers well in 1 or 2 weeks and is back to routine activities like driving, walking, and going for a job very quickly and easily. The compression garment is also needed to be worn for several weeks to make sure that the swelling goes down and the result becomes even better. So a body lift is not about having a dramatic change overnight. It is to restore the confidence and the precision and the definition. This is done with proper planning to have a definitive, major, significant transformation. If you have any questions about the procedure, please contact us immediately. I'm Dr. Abizar Kapadia, plastic and cosmetic surgeon.